Okay, just for the record, name and title, please.
Jason Bellak, Bellak, allergy and immunology specialist physician, MD.
Okay, so the reason I wanted to talk about this today is everyone knows Barry Manilow, and unfortunately he had a diagnosis recently, and it sounds like that wasn't even what he went in for. So I want to talk about the importance of really taking precautions and checking stuff out. Um, From my understanding, he went in because he had two bouts with bronchitis, but then they said, let's do an MRI. And during the MRI, they found the lung cancer. How common is it for people to find things like this when they're going in for something else?
It's a great question, and like you mentioned, everybody's case is different and individualized. In general, if typical cold bronchitis should last a couple weeks. If something's going on, particularly a cough, more than 3 weeks, certainly worth considering additional evaluation. Absolutely, 2 months or longer, definitely would get imaging of the chest. Um, I'm sure he had a chest X-ray first. Most people that's required by their insurance, and if the chest X-ray is negative, it doesn't mean that there isn't anything potentially wrong with the lungs. Chest X-rays, can find bigger things, but they're not detailed enough to pick up potentially smaller things, including in some cases smaller cancers that are better imaged with CAT scan or MRI.
When is it important to say, hey, can I get the CAT scan or the MRI? When is it, even if you think it may be something like bronchitis or whatever it may be, at one point is it important to say, hey, maybe I should go get checked out and do the next step?
There's definitely some red flags. Unintentional weight loss, night sweats, waking up drenched, a fever that is not going away. Typical cold that we're all seeing right now. Bad for the first 2 to 4 days, should be getting better by 7 to 10, completely better by 2 weeks. If it's not following that pattern, certainly if you're coughing up blood, which is the most common cause of blood streaks in the sputum, is bronchitis, but that's still a red flag that deserves some additional evaluation. Um, and again, a persistent cough that's not going away after a minimum, or excuse me, maximum of 3 weeks should be evaluated.
You said this is for the common cold, bronchitis, those types of things we see in the season, flu as well.
I'm sorry, I didn't understand the question.
Oh, sorry. You're saying these are the symptoms that could be something more during things like during the time of typical cold bronchitis and flu. Is that kind of the times where you may have these symptoms, but you need to look out for maybe some of those additional things?
Well, with your typical colds and flus, you may get a fever and the body aches and chills and some sweats, but those should only last 3 to 5 days, usually at the most. If it's going beyond that, certainly beyond 10 to 14 days, if you are losing weight unintentionally, chest pain, especially focalized chest pain that is maybe on one side or the other. Oftentimes with bronchitis, you'll get kind of central burning or chest pain. It's not localized to one side of the chest, which would be more concerning.
So essentially, sometimes you may think it's something smaller, but if something seems a little off, it's lasting too long, it is important to check because it may be something worse.
You are your own best advocate, and if it doesn't seem like it's right, continue to look for answers and see somebody that's going to take a good look at you and listen to you fully, and certainly get that initial chest X-ray if you have any of those red flags.
Because if you wait too long, then it's going to be harder. It sounds like with Barry Manilow, they caught it early on, which is the good thing, right?
Yeah, see, the key with so many things, particularly cancers, is early detection. Um, so getting that imaging when it's appropriate, or when symptoms haven't resolved. There are certain higher risk patients, patients with other underlying lung disease like asthma or COPD. My understanding is that Barry Manilow was a smoker for many years. That can contribute to increased risk for lung disease, not just cancer, but COPD. And patients with at least a 20 pack year smoking history, so that means a pack a day for 20 years or more, that are 50 and older, should have a lung cancer screening with a low dose CAT scan yearly starting at age 50. So that is approved and paid for by insurance from 50 to 80 years old in patients with a 20 pack year smoking history who have quit or are still smoking within 15 years.
And the CAT scans and MRIs pick up more than just lung cancer. They can find a variety of cancers, correct?
Yes, I found it interesting that his was picked up on an MRI. So they may have been looking again for other things and found this incidentally. Um, Standard is CAT scan first for most lung disease concerns. Now, there are other um, things that can be found by MRI that gives you some different detail as far as different types of cancers or vascular or blood vessel issues.
And just lastly, which type of doctor would say, hey, a CAT scan or an MRI? Is it any doctor you go to? Like if you say, hey, my bronchitis is lasting too long, who do they go to that would then order that next? Is it any type of MD or how does that work?
Great question. So typically that's going to be your primary care, family, internal medicine doctor. Um, uh, Certainly, if a patient has an established relationship with a pulmonologist or allergist like myself, I'll often see patients refer to me for chronic cough, and they've had a negative chest X-ray, but they haven't had any more advanced imaging like the CAT scan, and I would be the one to do that, as well as, of course, evaluate for other reasons of having a cough, everything from asthma or COPD to even acid reflux.
You caught patients who ended up having cancer through some of these things that they may have thought was something else.
I would love to say that I haven't, but unfortunately I have. And Sometimes this happens because there's a kind of a failure of follow-up or communication. And I would say again, patients are always their best own advocate. Sometimes, no news isn't good news. It just means maybe something fell through the cracks and they weren't communicated with some of the findings. So if you get some type of test, including a chest X-ray or CAT scan or MRI, um, you should be able to get those results within a couple of weeks, either from the person who ordered those or the radiology company that did the study.
Dr. Bellak, thank you so much. Anything you think we missed at this point?
Again, this is the time of year where, I've had 5 sick visits today. This stuff is going on, and bronchitis is common. Having lung cancer is not as common. So I don't want everybody to be worried if they have a cough that they have something malignant. It's when that doesn't clear up as it normally should within a few weeks or some of those red flags that definitely should be seen. Um, Best if it could be a primary care, family internal medicine, or a specialist in lung disease like myself or pulmonary medicine.
Thank you.